Newsmaker Sunday with Fox 10's John Hook.
Thanks for joining us on Newsmaker Sunday. We're going to talk about Obamacare or the Affordable Care Act, whichever you prefer. What happens if it is repealed? And Donald Trump this week promised that they are going to repeal this thing, and he's even talking about repeal and replace almost simultaneously. Can that be done, and what does it mean to the millions of Americans who are on this thing? And in Arizona, you're talking about 200,000 people enrolled in the Affordable Care Act, and then people on Medicaid that are also affected and impacted by this. So we're going to talk about it this week on Newsmaker Sunday with Dr. Eric Novack, chairman of Arizonans for Healthcare Freedom, and Dr. Len Kirschner, who's the doctor and president of AARP of Arizona, but also was the longest-serving director of Arizona's healthcare cost containment system, better known as Access. Thank you.
Actually, Bedlock has just passed me.
Oh, really?
Yeah, this summer.
No kidding.
Yeah.
I didn't know that.
I had 6.5 years, and Tom now is approaching 7.
Well, this is like he surpassed Jack Nicklaus. This is Tiger Woods surpassing Jack Nicklaus. Good to see you both.
And I'm also past president of AARP.
Oh, you're past president. I've got old information here, Len. But he's still a very interesting advocate of the healthcare world. So we're going to hear from Len, and in fact, we'll start with you.
Right.
When Donald Trump talks about repeal and replace, and it sounds like everybody's on board with this, at least on the Republican side, what does that mean to you?
Well, it means that they don't have a plan yet, and we were talking earlier, and so I was just reading you the headlines from Wall Street Journal, New York Times, USA Today, and Arizona Republic today on just that subject. Probably the best laid out plan was laid out by Paul Ryan, the Speaker of the House, in June when he had a 35-page document on a better way. But even that doesn't address it. And understand, Obamacare is not just the exchange. When they talk about it and they just say the premium is going up, well, there's a lot of other things to it. The Medicaid expansion is larger. In Arizona, about 700,000 people are on Medicaid now who would not have health insurance. A little under 200,000 on the exchange.
Right.
It also affects Medicare, the donut hole. So it has impacts across the spectrum. And so when they talk about repeal and replace, so far the details, the devil in the details, aren't there on the replace side. And during the election, Mr. Trump, President-elect Trump, soon to be the president, never had any details. His healthcare information on his website was about a page and a half and said 7 issues. Number 1, repeal Obamacare. Really nothing else about how to replace it.
Dr. Novack, when they figure this out, can they, first of all? I mean, when you repeal something like this, when you've got all these people on this, we're at 20 million around the country right now, roughly?
Give or take. I mean, I think probably about at least 2/3 of those are actually just added to Medicaid. But the common number is probably between 15 and 20 million people.
That's a lot of folks. So if you repeal something, you've got to have something to replace it or there's chaos, right?
No question. Although people have to remember that when the Affordable Care Act was passed in 2010, the proponents claimed that there were going to be no disruptions, nobody was going to lose their plan, that all these wonderful things were going to happen. When we know 6 or 7 million people lost their plans, people in Arizona are seeing massive rate increases, up to 115% going into 2017, for example, on the exchange. There have been massive disruptions already, regulations impacting providers, hospitals, and patients, making care harder, networks narrower, fewer hospital options. So it's been disruptive to date. There's no question there'll be changes. Len did mention that the Republicans haven't had a plan. The reality is there have been multiple plans, and the Secretary of Health and Human Services designee, Tom Price, for example, has actually had a real bill since 2010. So while we don't know the details, there are definitely alternative approaches to hopefully address the 2 big issues, which is lowering costs for the vast majority of Americans and providing access to those people who really need care. And there have been huge gaps in that under the Affordable Care Act.
Refresh my memory. When this was first proposed, I seem to have stuck in my brain that they were talking about trying to insure 60 million people. Wasn't that the number they were going for?
No. The estimates were that they were somewhat shy of 50 million people uninsured in the country, running about 18%. Arizona had a higher percentage than the national average. Actually, they've done a pretty good job on getting that coverage. It's been both Medicaid and, in this state,
And by the way, the coverage just increased in this last quarter, didn't it? Didn't they get some big numbers? Yeah, I think they had 300,000 more people signed up for health insurance this year than last year as of late December.
So if you deal with the three big, I think there were three big issues: accessibility, affordability, accountability. Accessibility means driving that number of uninsured down. They've done dramatically well. We're down now the lowest percentage of uninsured population in the country in the post-World War II history. The cost side, the affordability, haven't done nearly as well, though the cost has not increased that much. Understand what they're talking about: an increase in the premiums on the exchange population. That's 200,000 people in Arizona. Yes, it's gone up. That's mainly because the early premiums were lowballed. The great majority of people in Arizona have coverage through their employees. Those costs are not escalating dramatically. Medicare and Medicaid. That's the big chunk of the 6.2 million, 6.3 million in Arizona.
Yeah.
So we talk about that, and the implication is it's the entire system that's exploding. That's not true. The cost of those plans and the fact that a lot of those insurance companies
formerly uninsured.
The formerly uninsured, that population that we're talking about in Arizona, a little less than 200,000 people.
Okay.
That's serious stuff, but it's not the big picture.
Dr. Novack, is that how you see it? Is he laid it out pretty accurately?
Not really.
Shocking.
Here we go.
Not really.
Okay, now it's game on.
First of all, if you looked at the predictions for how many people will be covered through the exchanges, the Congressional Budget Office, which was deemed as the smartest arbiter of what the numbers were going to be, those numbers are off by 50%, meaning 50% fewer people are actually covered than was predicted by the administration and the CBOs. They predicted about 23 million people covered under the exchanges nationwide, and there were only around 11. So that's number one. The flip side, which is equally important, is the Medicaid expansion, because nearly everyone believes, and I put myself in that category, that we do need a functioning and sustainable safety net healthcare system. When the debate over the expansion of Medicaid happened here and at the legislature, proponents made the case that by 2020 there would be about 230,000 additional people in Medicaid in Arizona. That's 2020. Here we are entering 2017, and the number's about 600,000.
Okay, what's going on?
With that comes a cost.
What's going on?
I think invariably when you have an expansion of entitlement programs, more and more people
seek them
sign
out.
up. The other thing that's a little bit fascinating about that is that Jonathan Gruber, who was a big proponent and advisor in the White House and famously got himself in trouble for what he really believed, just came out with a study that actually implied that about 60% of all the people under Medicaid expansion nationwide were already eligible but had not chosen to sign up. So it further drives down the actual number of people who have, quote, gotten benefits under the law. Yes, there are provisions here or there, but when you look at the tens of thousands of pages of regulations, the enormous burden is placed on providers, the impact of rural hospitals. There have been 80 rural hospitals that have closed since 2010, including three here in Arizona, and a report suggesting there's another 600 or 700 at risk. That the net, there are winners under the Affordable Care Act, but what the proponents refuse to acknowledge is that there are millions of people, and I guess my patient population, as well as my employees, would definitely take issue with the idea, well, it's just a couple 100,000 people who've seen the rates go up. I think I pay about $440 per month per employee, plus my employees pay money on top of that, plus they have massive deductibles. So there's been an adverse impact across the system.
Yeah, the insurance system has been changing, but let's go back on the access side and what this means. Clearly, we had an initiative that said we would cover individuals, childless adults, up to 100% of poverty. We covered them. That was about 250,000 people. When the economy went south, the legislature stopped that, and they were able to do that. And that population dropped down into the tens of thousands. When they reopened that, when Governor Brewer reopened it, and Governor Brewer has called access the gold standard, that population came up. So to say that it increased that much, that 250,000 of them were already there, they lost it, they came back.
Since you ran access, I had always heard when Bruce Babbitt put this thing in back in the day, I was starting in radio at that time, everybody said this is going to be the model for the nation eventually.
And it is. What's amazing, when I became the director in '87, we were an outlier. Arizona was unique. Today, every state is moving in the direction of where Arizona is. That's why I'm going around the country speaking at conferences, because they see Arizona still as the model. I've done consulting from one end of the country to the other.
So if we're the model, why didn't we become the model nationally for the Affordable Care Act?
Well, the Affordable Care Act was a different issue. The Medicaid expansion was part of it. clearly what happened was the Supreme Court in this decision said the mandatory Medicaid expansion should be optional. So a number of states have said with governors, Republican governors, that we're not going to expand. There are quite a few states now with Republican governors that have expanded.
Did Governor Brewer make the right choice?
Absolutely.
Taking the federal money. Do you think she did?
I'm not convinced it was the right choice. I mean, spending has absolutely exploded. By the way, the 250,000 prediction that the proponents had in 2013 included the Prop 204 population. That's the data. And
no, that's not true. We knew they were going to come back in.
Spending has exploded. If you look since 2014, we now spend, the estimates are we're going to spend about $11.4 billion on Medicaid here in the state, compared to about $6.5 billion 4 years ago.
And think about it was when I was the director.
Spending is exploding, and the question is that really sustainable, and who's being hurt?
Let me take you to Mark Martinez, who did a piece. This is a week ago. It's still relevant because the same discussion was going on in Washington. This is more the political tone and the political look at this. Take a look, Mark Martinez.
The first order of business is to repeal and replace Obamacare.
The Republican plan to cut health care wouldn't make America great again. It would make America sick again and lead to chaos.
Tensions fair with just weeks left before the Trump administration takes over. Today, President Obama met behind closed doors with House and Senate Democrats looking for a way to save the Affordable Care Act.
The prospect of, oh, don't worry, the 22 million Americans who have health insurance because of the Affordable Care Act, we'll get around to offering up a replacement at some later date. That's not a responsible way to govern.
And at almost the same time, Vice President-elect Mike Pence met with congressional GOP leaders to push for the dismantling of the legislation.
So we want to make sure that as we give relief to people through Obamacare, we do it in a transition that doesn't pull the rug out from anybody.
The 115th Congress will be the first Republican-dominated House, Senate, and President in a decade.
No. Back on Newsmaker Sunday. Len Kirschner, Dr. Len Kirschner, former president of AARP, and up until recently, he's now the second longest serving director of Access. Dr. Eric Novack, chairman of Arizonans for Healthcare Freedom. Implied in the title is that there was no freedom under, quote unquote, Obamacare, right?
Well, I don't know that there's no freedom, but what we've seen is an increasing number, not just of Arizonans, but for people around the country who have lost access to the doctor of their choice, who've seen their network shrink, who've seen their opportunities go down, while simultaneously seeing their costs explode.
What would have happened had we done nothing? Had we continued treating people in emergency rooms? Would it have been less expensive?
No, it would be a disaster. We would see that the uninsured population would go from 50 million or so American up to 60 and 70 million, because the insurance market was changing. That was not sustainable. We needed to move forward. Unfortunately, as that debate went forward in the first couple of years of the Obama administration, the Republicans and the Tea Party said no. The reality is the Affordable Care Act built on things that the Heritage Foundation, a Republican think tank in Washington, proposed, and what Mitt Romney had done in Massachusetts. It's not exactly a liberal Democratic concept. This was really driven by a lot of thoughtful Republicans in Washington. And we're now seeing that the inability to move forward in a bipartisan way was one of the most destructive parts. Not be able to really work across the aisle. And I hope we can do that now.
Is there an opportunity to do that? It's a poisonous atmosphere again in Washington. Yeah. The election of Trump hasn't solved that issue, but will Democrats, if they say, look, we're not going to just junk the whole thing, we're going to try to improve upon it, could Democrats sign on?
Yes, because understand, Medicare started a little over 50 years ago, on July 1st of last year. Harry Truman had Medicare Card 1, his wife Bess had 2. The only thing constant about Medicare for these 50-plus years has been change. It has been changed with every administration. Medicaid has changed also, and the insurance market has changed. The one thing that we can say is constant is change, and we will see change. Obamacare will morph into something else, and it'll be called maybe Trump care.
So, Dr. Novack, on balance, what Len is saying, it was still the right thing to do, even if it was imperfect.
I think it was a big mistake. I mean, first of all, while there is that regular claim that it was a Republican set of ideas, it passed Congress with 0 Republican votes. And the implementation has been done without really almost any Republican input. We had 2 major problems in 2009, which was we had a real number of people, measuring in the millions, who with significant pre-existing conditions, who had difficulty accessing health care, and we had a cost problem. That was the fundamental problem before, and nobody felt like we didn't have to make changes. The issue is that the Affordable Care Act really didn't make a big, huge dent in large chunks of that, because a lot of the people who had significant needs were already eligible either for Medicare or Medicaid. So there have been real winners under the Affordable Care Act, but what people refuse to acknowledge is that there are millions upon millions of people who have been net losers under the Affordable Care Act, and it's those people, I would posit, a real number of those people who have been repeatedly ignored or told that they're too dumb to know what's right for them, who ultimately turned around and voted for the Republicans in this election.
Someone I know quite well who's in the healthcare industry told me that the minute you start demanding that you insure people with pre-existing conditions, he told me you are out of establishing risk pools, and it is no longer, by definition, insurance. You are out of the insurance business at that point. You are mandating a program, and it isn't insurance anymore.
Everybody has to be in. And if you're going to cover pre-existing conditions, then people who aren't ill need to be in. Wonderful cartoon. It's the insurance agent sitting on a couch with Mrs. Smith. Mrs. Smith, reason I can't sell you a life insurance policy on your husband is he's already dead. And that's a pre-existing condition. Well, you can't sign up for health care, auto insurance, home insurance when the house is on fire, the car is a wreck, and you're being wheeled into the emergency room. Everybody's got to be in the game. That hasn't happened for a number of reasons. The incentives haven't been strong enough.
Everybody being in the game. Are we talking single payer now?
And Medicare, everyone is in the game in Medicare. And that's why that op-ed in today's USA Today says we ought to think about Medicare for all. You know, Bernie Sanders clearly said that, didn't fly. And I'm not sure that's going to fly now.
One thing before we take a break, clear this up for me. There's been this debate about when the Affordable Care Act was passed, people have said, well, they knew it was going to fail, and they didn't care because they said it will push us towards single payer, which is really the ultimate goal. Do you believe they were really thinking in those terms?
I don't think they were that cynical. I do think that they were dealing with the issues, and after Ted Kennedy's death and losing the 60 votes in the Senate, they had to move forward. Otherwise, they're going to be in the same situation the Clintons were back in '93 and '94, not getting a vote, not getting anything. And what they got was what they got. We have moved forward since then. I mean, MACRA was passed with an overwhelming majority. That impacted Medicare, Medicaid, and the Affordable Care Act, the way we pay physicians. So there are possibilities of working across the aisle. And that's, you know, I worked for 3 governors, 2 Republican, 1 Democrat. I worked across the aisle, and I really think that's the only way we're going to solve it. And I hope that the Democrats actually work with the Republicans now that they're in the majority and they have the White House to really solve some of these problems.
Dr. Novack, do you think that's likely?
Hopeful, optimistic. I think that if you look at the Washington politics with the way the 2018 midterm election cycle is, there are a large handful of Democrat senators in very Republican states who are going to be incentivized to do it. But, you know, we're in a pretty hyper-partisan era right now. And I think if Republicans are smart and focus on the basics, which is how can we make an immediate impact to lower costs without being coercive. Len talks about incentive. What he was really talking about is fines, coercion, and penalties in terms of getting people into the pool. I don't think that that is either necessary or appropriate.
How do you get people in then? How do you get the healthy people in who are going to pay for it?
Well, remember, we've lost a lot of the people who used to get it before because they just simply can't afford it.
Right. I mean, young people are saying, you know what? It's either my car payment or this stuff, and I'm going to say I'm going to probably be healthy. I'll skip the health care part, and I'll make my car payment. I mean, these are decisions people are making.
And I'll pay the penalty.
Right.
There's no question that that has been part of the discussion. It is not the final answer. We are going to have that. And as I said, every paper I picked up today has got front page stories and editorials on what is going forward. And as you saw in the clip here, from the Vice President-elect, healthcare is right at the top of the agenda.
Oh, yeah,
there will be other things that will happen.
Right. We're going to take a break here on Newsmaker Sunday. Dr. Eric Novack, who is the chairman of Arizonans for Healthcare Freedom, is our guest, along with Dr. Len Kirschner, the former president of AARP and the second longest-serving director of Access. Back in a minute on Newsmaker Sunday.
In every case, your coverage will go down even though they said your coverage will get better and you can keep your doctor. Most likely, there's a good chance that you may not be able to keep your doctor, and your coverage will have higher deductibles, higher copays, more out of pocket.
That was Tony Martin, who we interviewed a little while ago here on Fox 10. He's an agent broker, Martin Insurance Agency, talking about what's happening out there with people in their health care. People got notices toward the end of last year that they're, in some spots, down to one provider, or I'm sorry, one insurer to take care. Can this be fixed if the Republicans repeal and replace?
I think they can start taking significant steps to improve the number of people who are winners under policies and try to reduce the number of people who can get hurt. Any policy is going to have significant change. Again, the Affordable Care Act is most notable for the fact that there are millions upon millions of people who are adversely affected, who felt like they were sold a bill of goods by being able to keep their plan, keep their doctor, and lower their costs, who now see an average family premium in this state of over $18,000, where their
you
average
predicted this on this program, what, 8 years ago?
Yep.
We talked about it?
But the reality is those costs for the private sector were going up, and they haven't gone up as fast as they did a decade ago. So, yes, the costs have gone up. But you know what we have also? We've got, nationally, we've added tens of millions of people to the Medicaid rolls. We've added about 12 million or so to the exchanges. So we do have people that are very much winners in this thing. And I say winners, these are people that need health care coverage. And they've got it now that they didn't have before. And the whole idea of the insurance industry as it existed prior to Affordable Care Act saying if you've got a pre-existing condition, you're not insurable. And I have talked to lots of people who are stuck in that bind, trying to figure out what do you do now to get coverage of any kind, period.
And no one's talking
That's unacceptable.
We're going to take a quick break on Newsmaker Sunday. Back with some final thoughts and the chances for success. If you're going to repeal it, will it be replaced with something better? Back on Newsmaker Sunday in a moment. Back on Newsmaker Sunday, the president-elect has promised to repeal and replace Obamacare almost simultaneously. Last moments with our guests, Dr. Eric Novack and Dr. Len Kirschner. Chances of that happening in one fell swoop, where you would repeal and replace in the same kind of time frame?
I think they will do it in short order, staged, but I think it will get done. I think the base that voted for the Republicans, both for the White House and for Congress, will demand it.
Len, is it likely we'll get something better out of this?
We'll get something different. But I think that it will not be repeal and replace immediately. And you understand that Governor Ducey has said to the Trump administration, don't mess around with our Medicaid. If they repeal it and they do away with the Medicaid expansion and the extra money from it, that is a huge hit to the governor's budget that he's releasing Friday. And that will destroy all the concepts that he put out in his state